Donnenfeld. I'm here at ASCRS. I'm a clinical professor at NYU and from ophthalmic consultant of Long Island. I've just presented a paper that looked at lifitegrast, looking at the response to treatment in patients who received lifitegrast. And what we did is we looked at 5 different subgroups of patients. Patients who had received lifitegrast in the FDA pivotal trials, looking at hundreds of patients, and we broke down the patients into 5 different subgroups. Patients who responded immediately by the first visit, patients who showed serial improvement over the 3 visits of the trial, patients who only showed improvement of about 60% at the end of the trial, and patients who had less than 60% improvement at the end of the trial, and then finally a small subgroup of patients who had less than 30% improvement. The results of the trial showed that a number of patients showed very early response to therapy with improvement of symptoms. They felt better, they were more comfortable, they had resolution of their dry eye, and it occurred on their first visit following their therapy. Another group of patients showed steady improvement over time, while some patients it took up to 6 weeks before they really showed response to therapy. The take-home message from the trial that we learned was that patients who had milder disease were the ones that responded best to therapy. And I think this makes sense in today's day and age. We all know that the more severe the disease, the less likely the patient will respond adequately. The take-home message for me as a clinician is that I want to treat patients with dry eye earlier, and I want to treat them before they become very symptomatic. They'll get a better response. Lifitegrast is a LCA antagonist. It basically prevents the adhesion of T lymphocytes to the ocular surface, and by doing this, it affects all forms of T lymphocytes, so it works quickly, it works effectively, and it works on all T cells, not just the novel ones that are associated with dry eye. Again, take-home message: if you have dry eye, manage the patient aggressively and treat early.